BRTO is what's traditionally been done in Japan for the last 2 decades, or even more than that at this point in time. And that procedure was essentially described as using a balloon to help a sclerosant sit in these gastric varices for prolonged periods of time, over 8 to 12 hours in some instances with a sclerosing agent called ethanolamine. Outside of Japan, neither the sclerosing agent nor some of the drugs that we used that were used to actually help with some of the complications like haptoglobin were widely available. So in Europe and in the United States, these variations of a BRTO procedure was performed where instead of using a sclerosing agent, they used different types of coil or plugs in place of a balloon, and then injected a slurry of usually gel foam and sometimes gel foam with sclerosants to perform the procedure. You're trying to do the same thing, which is sclerose gastric varices, but you're trying to do it in a much faster, controlled, easier, kind of user-friendly setting. So these variations on classic BRTO were generally done so this could be a one-and-done procedure rather than a long infusion in an ICU. Usually the procedure is done in the context of portal hypertension and bleeding gastric varices. And like I said, in Japan, where it evolved, they didn't use a TIPS procedure very often, which was used extensively throughout the United States and most of the rest of the world. So when this procedure sort of became more widely accepted and more widely available, people had to choose between TIPS and BRTO. And what people found was, generally speaking, there are certain subgroups of patients which do better with TIPS and certain subgroups which do better with BRTO. With complications, I think the really important thing to look at is patient selection, and that's probably going to be the key component of knowing which is preferable. BRTO aggravates portal hypertension. So, patients with ascites, hepatic hydrothorax, a portal vein occlusion, or even bad esophageal varices generally will do better with a TIPS. At least in the United States, most people would do a TIPS for those procedures. On the other hand, patients with hepatic encephalopathy, patients with high MELD scores, or patients who could easily have their esophageal varices banded or treated, probably will do better with BRTO. And BRTO tends to have a little better long-term survival in those patients. Now, obviously, you could also combine both procedures, and I think that's something that's going to be done a little more commonly in the future. In terms of developments, I think we're seeing more of an evolution of the field rather than a revolution. So as we've developed better catheters, better embolic materials, better types of plugs, it's made the procedure much easier, and that's gone hand in hand with improved imaging, which also has helped make the procedure go faster and make it safer. I think a lot of interventional radiology departments now have these combined CT fluoroscopic units, which we do, and some of that can make this a lot more straightforward to perform. So I think that those are the sorts of things, these materials and technological advances are just making it more user-friendly and safer. Well, I think the one thing that we really need to learn better is to understand exactly who's going to benefit most from a TIPS procedure and who's going to benefit most from a BRTO, or who's going to benefit most from a combined procedure. I think we know sort of on each end of the spectrum, like I mentioned earlier, who should undergo a TIPS procedure, and on the other end of the spectrum, who might be better suited for a BRTO or a PARTO or a CARTO type procedure. But there's this giant subgroup in between, which I don't think that we have a really good understanding for who's going to do better. And what you're seeing a lot, I think, is sort of geographic and sort of or a physician preference on which procedure they choose for this group. And I think in the coming years, we're going to probably see better comparative studies to help elucidate which patients are best for which type of procedures.